My symptoms began when I was a teenager. And by the time I was 18 years old, my symptoms were extremely severe. I had horrible abdominal pain. I had very rapid pulse and even a little bit of confusion. But this pain was so severe that I'd never felt anything like it. I was doubled over in pain. Pain is an understatement. Agony comes a little close. If there was a stronger word than agony, that's what it would be in the abdomen. I would go to one doctor after another. First they believed me and were trying to find what's wrong, but nothing shows on any test. A normal test does not show porphyria, only specific porphyria tests. Finally, I was at the doctor so much, I was tagged a hypochondriac. I was just a young teenager with menstrual-related symptoms, and I was making much ado about nothing, when in fact I was in horrible pain. Of their own, most physicians have never had a patient. Most physicians have never done more than, say, read an article in medical school. So, and porphyria has its unique challenges and its unique symptoms. So you would want to find a physician who is really willing to learn a lot before. If you've ever been through an attack, you're terrified to go through another one. And part of going through another one is often precipitated by the wrong drugs or the wrong treatment. So it's a very special thing to make sure you have a doctor who either knows about porphyria or is willing to learn about it from an expert. The challenge of porphyria is pain that for me was like 1,000 flaming swords in my abdomen. 1,000 flaming swords. That's pain that's not comparable to anything that you've experienced. That makes it very difficult for a patient to come in with that kind of pain and nothing show on a test. So many times patients have had every test there is for for Crohn's disease or SIDA, for any number of gastrointestinal problems, and yet nothing shows. But be diligent, because porphyria, it may be rare, but someone has it, and that someone might be you. The person who has this rare disease has to deal with some unique challenges, one of which is with acute porphyrias. They're acute, so it's very difficult. The symptoms are horrible, but it goes away. So many people think that it's in their head, because often they've not been diagnosed. Often they look perfectly fine in between these horrible episodes, so they're not taken seriously. You know, a person that looks fine today and is doubled over in horrible pain tomorrow and suffers this pain for 6 days and then is fine again, do you take them seriously? Often not. When I was tested and found out to have acute intermittent porphyria, the physician asked that we test the entire family. He was a porphyria expert. He found out my mother had it and 2 of my sisters. 3 out of 5 children had this disease. Then we, of course, immediately tested the rest of the family, because we knew that by testing, by being aware, we could prevent future life-threatening attacks. And it turned out, in fact, we did. The minute my sisters got sick, and they both got very ill, we knew exactly what to do. Even my niece, very ill, we knew exactly what to do. So this awareness, getting tested, the whole family tested, is extremely important. Do I have a normal life? No. But do I make it a normal life? Yes. And here's how. I follow very closely the safe and unsafe drug list. I don't take anything or do anything that could precipitate an attack. I eat extremely healthy. I get plenty of exercise when I'm able, and I make sure that I know everything that I can. For porphyria patients, those who know the most do the best.